Chapter 8 is called Sick Days, Emotions and Stress. And I wondered why this was important, especially since we're not talking about any sickness caused by your diabetes. We're talking about simple things that everyone gets, like a bad cold or the flu. And everyone exhibits some emotions during stressful times. Well, it turns out that a cold or flu to someone with diabetes is a very serious thing. And emotions and stress can cause wild fluctuations in your blood sugar. Here's some advice from our patient panel.
If you get the flu or a cold, a lot of people don't want to eat. They're running a fever, they're vomiting. It is still very important that you keep in touch with your doctor and you don't stop taking your medication, because when you're sick and you're a diabetic, your blood sugar usually goes sky high.
When you're sick, you tend to feel worse, I think, when you're a diabetic than when you're not a diabetic.
It is hard whenever you are sick because you think, oh, gee, should I take this? Shouldn't I take that? I don't know. But you do. You still have to take it no matter what.
I usually go to the pharmacy and ask them, what can I take? I'm a diabetic. And they'll come out of the place and show you what cough medicines you can take.
When a diabetic gets upset, their blood sugar shoots up high. So they've got to, keep calm. Stress will make your blood sugar go up high.
What you should do is continue with your medication just the way you normally would and put up with it being out of control.
And as much as you hate to do it, you should still eat even though you're sick, because you could also bottom out, and you don't want to do that you would go into insulin shock.
Watch, make sure if it goes up, take your, if you're on the insulin, take your insulin. If you're not, call the doctor as soon as possible, because you do have to make sure that you're doing okay.
So it's very important that you keep close tabs when you're sick.
Flu can and often does lead to pneumonia and other serious health problems. People with diabetes are 3 times more likely to die from these conditions than the general public. 3 times more likely. This is serious stuff. Listen to Jan Albert from the Conemaugh Diabetes Institute.
At some point you may develop an illness, a flu, cold, and with diabetes you need to know a couple things. You need to be able to check your sugar a little more often. It's very important that you eat regular meals and also drink the right type of fluids. The other thing I want to caution you, if you have nausea or vomiting for more than 4 hours, you need to make a call to your doctor. And most importantly, you need to take your medication, both your oral medicines and your insulin. So come on down to Conemaugh Diabetes Institute and let us make an individualized plan for you when you're sick.
Good advice, Jan. And this word of caution is not just about getting a flu or a bad cold. If you get injured in a car crash, have to undergo an operation, or anything that interrupts your normal intake of food and liquids, be aware that this is more serious for you than for a person without diabetes. And always keep an eye on your body for cuts or wounds that don't heal. They can get serious quickly.
I had 3 fractured bones in my foot, and that's when they found out that I had the diabetes. They had a Happy Feet program where they come in and check your feet, and that's when they found it. With the 3 fractured bones, I had to have pins put in the bottom of my foot. And one of the places they put the pins in developed a callus, but they said I should go into the wound healing clinic to have them work with it. Keep an eye on your feet. You never know when a wound might show up.
It's very important that people with diabetes pay attention to their feet, because they want to be able to provide very good foot care so that they prevent infection, that they prevent wounds from forming, and therefore they will prevent any type of amputation from occurring. People with diabetes should not treat their own calluses, own wounds, or infections, and actually should not perform their own nail care. If they examine their feet every day and they find that there is something that's abnormal, such as a reddened area, an area they think is infected, a callus that is now growing and they feel that it should be addressed, a podiatrist is an excellent source of help for the person with diabetes. The wound center, we treat diabetic foot ulcers and problems every day, and we have good outcomes. The sooner the patient comes there, the better the outcome. They're very treatable.
Thanks, Tricia, and thanks to the caregivers at the Wound Healing Center for all they do.